Hi, I'm Dr. Mark Poray, a family chiropractor in Brooklyn, Ontario. I recently had a new patient who came in to see me with a condition called TOS, or Thoracic Outlet Syndrome. She's been under the care of a physiotherapist for several months without any appreciable improvement. TOS is actually a fairly common problem, but one that's confused with a number of other conditions like disc herniations in the neck or shoulder bursitis. She was told by one physician, in fact, that she had cubital tunnel syndrome, a condition that starts in the elbow, and told by another physician that she had this thoracic outlet syndrome. So why the discrepancy, and what is it that a chiropractor can add to these treatment possibilities? Well, according to the Ohio State Medical Center, thoracic outlet syndrome occurs when nerves and blood vessels that come from the chest to the arm are pinched. Anatomically, the brachial plexus is a network of nerves in the neck and shoulder. It's formed by the nerves that branch off the spinal cord in the neck and the upper back. This intricate group of nerves communicate between the spinal cord and the upper extremities. Its location in the front of the neck and the shoulder and the chest leaves it vulnerable to impingement by the ribs, collarbone, or muscles. According to the American TOS Association, symptoms of TOS include positional weakness of the arm, and that is weaknesses that are dependent on the position of the arm. Tingling, numbness of the hands and fingers, especially the fourth and fifth fingers, difficulty in grasping or holding an object, possibly even swelling of the hands and arms, weakness in the hand and arm, cold sensations in the upper extremity, along with possibly color changes due to the blood vessels being pinched in that area. Injuries that result in thoracic outlet syndrome include fractured collarbones. It can also be the result of an extra rib that you were born with, or muscles or scar tissue. Sometimes it can be the result of the positions that your body takes or your arms take while you're at work. To determine if you have thoracic outlet syndrome, a number of physical tests can be done after your history has been taken. These can include nerve impingement tests, nerve conduction tests, as well as x-rays for the extra ribs, or an MRI, or even some other test possibly. Now, a chiropractor will examine the function and the mobility of the cervical vertebrae, the first rib, and the collarbone. These may, if they have been slightly moved, cause a pinching of the nerves and blood vessels in that area. The chiropractor can then correct the position and the motion of these and provide some exercises to help support the therapy. Soft tissue work should also be included, so you can be looking at myofascial therapy that can be directed at the pectoral muscles or the trapezius muscles or the scalene muscles in the neck. You can look at a number of possibilities yourself that can be helpful. Self-correction, you can look at perhaps pressure that's coming from a seat belt or the position of your neck while you're asleep. For women with larger breasts, give them some thought to a wider strap in your bra. These are simple fixes, and they may or they may not work. If you've not spoken to your chiropractor about these symptoms of hand and arm numbness or tingling, don't wait. Speak to them as soon as you can. I hope this has been helpful to you. I'm Dr. Mark Poray. My office is located in North Whitby on Highway 12 at the Brooklyn Family Health Center. You can make an appointment with me by calling 905-655-5767, and you can also find more weblogs which are available on my website at www.drporay.com. Thanks again for watching.